around so my light's better.
Okay.
This is a courtesy announcement that we are now broadcasting live on the internet.
Hi, Carl. Can we do a mic check, please? Hello, Supervisor Wasserman. How are you?
Hello there, David. I'm fine. And I'm going to grab my door and I'll be right back.
Okay. Dr. Smith, can we do a mic check, please?
Yeah, sure. Can you hear me?
Yes, we can hear you and we can see you. Thanks.
Okay, thank you.
Michael, can we do a mic check with you, please?
Of course. Good morning.
Good morning. We can hear you. Thanks very much.
I'm back. Hi, David.
Hello.
Good morning, President Wasserman.
Well, good morning, Vice President Ellenberg.
We are 3 minutes out.
All right. I will see you in 2.
Good morning, Charles. Can we do a mic check, please?
Yes, can you hear me?
We can hear you and we can see you. Thank you. Casey, can we do a mic check with you,
Thank you.
please?
Yes, my apologies. I was a little late. Good morning.
Good morning. Thank you. Sorry to catch you in the middle of your coffee.
That's okay.
You are not late, Casey. We're only at 9:58.
Oh, good. Okay.
And our Zoom doorbell and my front doorbell sound too similar. And I keep going back and forth.
I'm turning the doorbell off now.
No, it's my doorbell. I just turned off. All right. Morning, Casey.
Morning, Supervisor. How are you?
You know, I'm doing all right. Doing okay. Went to bed at 12:15 last night, got up at 6 o'clock this morning. And, but I'm still 20 and pulling an all-nighter at SC, you know, I can do
it.
that. Hey, Molly.
My 6-year-old woke me up at about 2:15 this morning because he had a bad dream. So hence the coffee.
I'm sorry about that. I took my 5-year-old out at 3 o'clock to go potty on the rocks. So it was almost the same thing.
Almost the same. Yeah.
Oh, I hope everybody else is doing well today.
All right.
Recording in progress.
There we go. Madam Chair, are you?
I am literally just looking at my clock. It is still 9:59. Don't want anyone to feel slighted about the time.
Gotcha.
And it is now 10 a.m. and I'm delighted to call to order the November 10th meeting of the Public Safety and Justice committee, and we have a new clerk. Welcome, Camille. And why don't you start by calling a roll for us, please?
Vice Chairperson Wasserman,
Here.
Chairperson Ellenberg,
I'm here as well.
and a quorum is present. Thank you.
Thank you very much. We're going to move now to public comment. Public comment is that portion of the agenda set aside for members of the public wishing to speak on items not on today's agenda, but within the purview of the committee. And Camille, do we have any speakers?
I see no hands raised at the moment,
Okay.
Madam Chair.
Great, then we will move on to item 3, which is the consent calendar. And Supervisor Wasserman, I would like to add item 10, which is the OCLEM work plan to consent, if that's all right with you, with just a very brief comment.
Yes, ma'am. If that was your motion, I'm happy to second it.
Terrific. So before we take a vote, I just want to thank the OIR group for keeping up to date on the ever expanding scope of work that the board has been assigning to you. The group has really made a world of difference in transparency, accountability, and best practices of our county, and looking forward to working with the new team members that they're bringing on. Thanks so much, Mike.
Thank you,
Thanks, Mike.
Supervisor. Thank you, Chair Wasserman. Really appreciate it. Appreciate your support.
Absolutely. Thank you for your good work. Do we have any speakers, Camila, on this item?
There are no requests to speak.
Okay, I made the motion. Supervisor Wasserman seconded it. So let's take a vote.
Vice Chairperson Wasserman,
Yes.
Chairperson Ellenberg,
Yes,
and approved. Thank you.
thank you. For item 4, the ATI work groups, we're joined by our facilitators, the Resource Development Associates, who have an update on the progress of the ATI work groups. And I am looking for, I think, Megan.
So this is Martha Lipinski, Deputy County Executive. Charlene Taylor's on the line for RDA, and we'll be sharing a status report of the work done in the last month since we last were here at PSJC.
Perfect. Thanks, Martha.
Thank you, Martha. Thank you, Chairperson Elmsberg. My name is Charlene Taylor. I am the Vice President of Consulting Services at RDA, and I'll be speaking for Megan and Taylor, the others on the RDA team today. As I understand it, you all have a written update from us as well. So I think I'll just kind of go through some highlights of that, if that's okay, and take any questions that you all have. After our first month of work group meetings, we at RDA decided that we needed to kind of take a beat and give the folks in the work group an opportunity to make sure that they were able to weigh in on the work that we were doing, and that we will be doing. So during the month of October, we postponed the originally planned sessions with each of the 3 work groups that were scheduled for October. The second session will now be held in November. We've held 2 of them already and have 1 more, and we added an additional session in March. We conferred with our county staff and elected to postpone these meetings to allow for more time for the members to identify areas of focus for the remaining work, and to allow for more engagement and information sharing from the work group members that could be used to inform our discussions in the remaining sessions. We know that there's limited time for us all to work together over the course of the next planned session, so leveraging the month of October to narrow down the focus areas was really important for us to help maximize the time spent on recommendations development during the remaining sessions, recognizing that that is the big deliverable for this process. We wanted to make sure that we were able to leverage all of the information and expertise that's brought to us by the work group members. So during the month of October, we had the work group members complete a couple of different activities. First, we had folks go in and add final comments, ideas, and information related to the potential impact areas that were brainstormed during the first work group session. We put together a Google document, sent it out for folks, and people were able to come in and weigh in and add more information. The work group members also completed a survey where we requested them to vote on their top 2 areas that they would like to focus the remaining work and recommendations development on. Based on those responses, the top 3 most popular areas of interest were identified for each of the 3 different work groups. For the intervention at the start work group, they identified alternative response programs and linkages to services. safe locations as an alternative to arrest and/or booking, and capacity of community-based services, as well as decriminalization of homelessness and poverty as their 3 focus areas. The criminal legal process group identified capacity of community-based treatment and services, diversion and restorative justice programs, and agency collaboration and general processes and practices as their 3 focus group areas. And the reentry group, we have 3 preliminary areas. We have extended the initial window of focus area voting till the 10th, since they are the last group, and we wanted to make sure we had as much engagement and participation as possible. So preliminarily, the 3 groups that they've chosen are release planning, mandatory treatment outside of a custody or jail setting, and services and opportunities available post-release. And so those are the areas that have been identified by each of the 3 work groups, and these are the areas where they will be focusing their attention to develop recommendations for the final deliverable at the end of this project period. We also asked for folks to share information related to 1 or more of the potential focus areas that work group members thought would be helpful for the group to have in the process. So we had pulled together some information that we had on each of these. We also are asking work group members to bring back to the groups in the next sessions any information that they have that would be helpful in making recommendations for these different areas. So that was October. So our key activities that are planned for November include an update to this group. We'll be hosting the 2nd sessions with each ATI group. As I said, we've hosted 2 of them already, the Intervention at the Start group and the Criminal Legal Process group. The reentry groups November session will be held next week. And then prior to each session, we're sending out background information on each of the 3 priority areas identified from the survey responses so that folks can come to the groups fully ready to participate. In our session 2, our key objectives are really around defining the issues, those priority issues that they have, and determining the current state of that issue in Santa Clara County, and what additional data will be needed to better understand the issue, and collecting that data if available. So that's what folks are doing for session 2. In session 3, we'll then be building on that to start putting together recommendations for each of the 3 primary focus areas for each of the groups.
Charlene, thank you very much for the report. Before I looked for public comments, I want to turn to the panelists, particularly any of you who are serving on any of the committees, to share feedback or comments if you have them at this point, or questions for Charlene while we have her. And I will scan for raised hands. And if I do not see any, let's see, do we have any public commenters?
There are no requests to speak, Madam Chair.
Okay, Supervisor Wasserman, any comments here?
No, I appreciate the report. It's just received, so no action, so I'm good. Thank you.
Right. Okay, thank you very much. We'll move on to item 5, which is the status of county diversion and ATI programs. And that's you, Casey.
Yes, good morning, Supervisor, and happy before a holiday weekend. So you have a legislative file that summarizes the efforts from our criminal justice departments. I believe at the last meeting you requested that we don't do a verbal report, that we present the legislative file, but all of our members are here if you have any questions. We also have the data points and the slides, and we can share our screen if you had questions about some of the data sets that were provided. So with that, I'll turn it over and see if anybody has any questions on the legislative file.
Perfect. Thank you so much for that, Casey. Supervisor Wasserman, do you have any questions or comments?
I just want to compliment as far as the various reports and the diversion program from the DA, and it was very informational. Thank you.
Thank you.
Thank you. And I would add, I agree with my colleague. It really is impressive to see how extensive the district attorney's been the ARC reforms have been, and I'm looking forward to hearing more about how camp work develops in the coming year. Would it be possible, Casey, to receive an update in 6 months to stay informed on this new program?
Absolutely. Are you asking for a camp update specifically?
Yes.
Okay, absolutely. And Stacy's on here as a representative from the district attorney's office, but I'm happy to follow up with David Angel, who's the assistant district attorney over that program, and also with Supervisor Brandon Cabrera, and let them know to be ready with a report back in about 6 months.
Fantastic. And regarding the overall item, I really have greatly appreciated the monthly reporting on the jail population and our department service numbers. Moving into 2023, I recognize the lift that these monthly reports have been for our departments, and I would be glad to move the reports to a quarterly basis, which I think will also lend itself to more robust analysis when we're comparing 3 months rather than 3 weeks of data. I would like to see the quarterly reports like the current monthly reports. Please provide an update on the jail population, the court backlog, and the KPIs for each of the PSJC's departments, alternatives to incarceration and diversion efforts and programs. I think I've requested in the past that I'd like to see some context given for the metrics that are reported, meaning that the data should not be reported just for the quarter that the report is coming out, but also, showing previous quarters so that we have a basis for comparison.
I will make note of that, Supervisor, and we're happy to transition to quarterly reports beginning in 2023.
Great, thank you. Sylvia, Independent Public Defender.
Thank you very much. One data set that I think would be really helpful, at least speaking just for myself, as we monitor the in custody unsentenced inmates. We have right now 153. In the past, I believe the sheriff's office would make a list available to all of us about who those individuals were, so that we could actually take some proactive action, if possible, on internally identifying any issues, delays, or opportunities for moving cases forward. And I found those to be helpful in the past. And if possible, it would be great to have that data set provided to us and the leadership.
So Director McDonald, are you referring to the unsentenced inmates in custody 3 years or more, that 153
Correct.
number? Okay.
Correct.
Yeah, and I don't believe that that's something that we would generally provide in a public setting, but
Correct.
we can talk about having the sheriff's office provide those to PDO, ADO, IDO, and the district attorney's office to facilitate collaboration on addressing that list and what might be done to lower those numbers.
Excellent. Thank you very much.
You're welcome.
Thanks. And Sylvia, I appreciate your drawing attention to that. In addition to the obvious direct impacts to people who are sitting unsentenced in custody for so long, there's a significant expense to the county that comes with that, from administrative costs to maintaining people in our facility for years. And I would also be interested in hearing strategies from the groups that are directly involved with how we might be supportive of the courts in reducing their backlog. So thank you for that. Brandon.
Good morning, everyone. I heard my name and I heard camp, so I simply wanted to introduce myself. My name is Brandon Cabrera. I'm the supervisor of the camp team at the district attorney's office, which stands for Custody Alternatives and Mental Health Programs Unit. I had a PowerPoint slide, and it sounds like maybe that circulated and people saw that. Here to answer any questions or even present on camp if you like, but simply just wanted to introduce myself, let you know we're here to advance all the programs, and I'm on the ATI committee and believe strongly in what we're doing here and really want the support of all the individuals here, and I'm here to listen and here to do whatever is needed. So thank you.
Brandon, thank you. We do have the slide. I generally prefer not to duplicate verbally what the public and the board has been able to see, but because this is a brand new program, if you'd like to take a couple of minutes to share the highlights, I think that would be terrific to just raise awareness.
Okay, completely your call. I know you guys have a busy agenda.
Go right ahead.
Okay, I do have some slides if you'd like me to share my screen.
Sure, if you can, yes, maybe a 3 to 5 minute presentation would be fine.
Great, let me do that real quick then. Appreciate the opportunity. Does everyone see these slides?
I can feel your enthusiasm.
No,
Don't want to say no.
no, we can't. There we go.
How about that? See the slides?
Yes, we can.
Yep.
Great. So camp, Custody Alternatives Mental Health Programs Unit. I think the idea to think of anything that involves diverting individuals out of the criminal justice system, providing second chances, or is based around mental health drug addiction, or something that camps supervise within the DA's office. There's several programs that are active right now. The first one is PAR, which stands for Pre-Arraignment Representation and Review. That's in collaboration with the Public Defender's Office. What the Public Defender's Office does is goes into the jail, meets their clients in advance of the arraignment date, will then contact me if it's an individual who simply does not need to be in custody those 2 to 3 days while they're waiting arraignment. We work collaboratively to get that individual out and get them a different arraignment date. The goal here is to decrease the number of individuals that are in custody, the duration for which they're in jail, and also reduce the arraignment calendars so that more focus can be paid attention to maybe more serious cases that need to be in that arraignment department. Another program we have is YADJ. It stands for Young Adults Deferred Entry of Judgment. The idea there is if you committed a felony offense between the ages of 18 and 21, we want to provide you the opportunity to not have that conviction on your record. You're going to go to one of our collaborative courts. This is Department 62 for a year of supervision. We tailor that supervision to whatever might have brought you within the system. Is there a drug problem? Is there a mental health problem? What can we do to change course there? Another program that we also supervise is ARC, Accountability, Rehab, and Community. The purpose there is to divert low-level felony sales narcotics cases. Through statistical analysis and just review of these cases, we realize that a lot of these individuals who are involved in low-level sales are also heavy users themselves. So what can we do to particularize treatment? And that's what a lot of this, what we're doing in camp is more treatment than punitive. So what can we do to assist that individual to not pick up new cases and to remove themselves from the system and selling of narcotics? Mental health treatment court includes a lot of things, but basically that's Judge Manley, which I'm sure many of you are aware, Department 6061, as well as Judge Silva. In those departments, we supervise everyone who is either on probation for mental health or has been provided the opportunity of mental health diversion, as well as restoration of competency locally. The idea there is to treatment over custody, to provide personalized and individualized treatment collaboratively with the public defender and the courts, and also to provide wraparound services for the individuals that we supervise and assist there. We also do forensic mental issues, which is really competency, restoration of competency, both on felonies and misdemeanor cases. The purpose of this program is to diagnose and restore individuals. What we're doing within the last year is diverting a lot of individuals, both felony and misdemeanors, where there's a declaration of doubt. Again, the purpose is to provide treatment as to sending people to the state hospital. We really want to reduce those numbers and provide as much treatment and supervision locally as we can. Another program that we're doing is sentencing recalls. This is DA-initiated recalls that if someone maybe 20 years ago received a sentence that is just disproportionate to what they'd receive now, or has really rehabilitated. We've received CDCR records, they're doing phenomenal, then we're proactively trying to calendar these matters and get these sentences reduced and give these individuals an opportunity back within the community. And these are DA-initiated recalls that we're proactively looking into. The last thing that we're doing is mass expungements. So a lot of changes in the law. If someone statutorily has been required or permitted to have their case reduced or dismissed, rather than waiting for individuals to request that, our office, along again with the Public Defender's Office, is being proactive and doing mass expungements, hundreds at a time, sometimes thousands at a time, to provide the necessary relief to individuals who should obtain that relief. And so as you see, a lot of these programs are collaborative. We work really hand in hand with the Public Defender's Office as well as with the court system. The idea again is to reduce the jail populations, to divert and redirect individuals from the criminal justice system, and really provide treatment over anything punitive. And so that's the goal of camp. Obviously, it's ever growing. A lot of these programs are pilot programs, but I'm here to assist with any facilitation of these programs and here to listen. So thank you.
Thank you so much for that, Brandon. Can you go back to slide 4? I had questions on 4 and 5.
Yes. Oh. 1 second, sorry. YADJ?
Fade in, fade out. Individuals under 21 years of age, why is it 21 and not 25? Since there's a general move to consider up to 25 year olds, generally youth, from a cognitive brain function perspective.
Great question. Right now, it is currently 21 based on staffing and ability to manage those calendars. We are absolutely intending to increase the age from 25 and under, but it came down to the ability to staff and have that calendar based on court staffing, judge availability. One of the goals in 2023 is to expand both YADJ as well as ARC. So it's something we're moving towards.
Great, thank you. And on 5, please.
Yes, 5.
Just looking at the diversionary treatments, I'm curious to know, we have declared a mental behavioral health crisis. We know that we are under-resourced in facilities, in funded slots, and in employee workforce. What are the wait times for people getting into programs, whether it's counseling or community service? Are you finding roadblocks there? And what happens if someone is an appropriate candidate for this kind of diversion, but there is not a facility or slot or bed available?
You really hit the nail on the head. One of the biggest situations we're seeing with people remaining in custody is appropriate locations and beds. It really comes down to beds. We do have the JACK list, which is the list of individuals who are eligible for release to given programs. And actually, I met yesterday also with the Public Defender Office. We've discussed with behavioral health. They keep really good track of the list of individuals who are ready for release. Crisis residential is one of our biggest issues, and we have a lack of availability to provide people in crisis residential as well as SUDS, which is basically like the drug release program. But the wait time really depends. It depends on the individual as well as the beds. We're seeing at least, though, on average, a minimum of 2 weeks, if not longer. Crisis residential takes even longer. One of the things I'm going to push in the ATI work group is the ability to get more beds for all these individuals, because if we had that, a lot less people would be in custody and be in the community doing this treatment.
Thank you so much. I could not agree more. We're receiving a report, I believe, at the board of Supervisors meeting on Tuesday about facility capacity overall, and then again in December about some of the expansion efforts, and truly support from all of the public safety and justice departments in moving us ahead with building out our continuum of mental health care and substance use disorder treatment care would be tremendously helpful. I think there are a lot of potential solutions and avenues of success here. And the more minds we have thinking of creative ways to add these beds and to add the appropriate levels of staff would be very much appreciated. So thank you very much for your participation in the group. I'm going to go to Chief Garnett and then Matt Fisk. And I think you can stop sharing your slides.
Absolutely. Let me do that.
Thank you, Madam Chair. Yeah, about the YADEJ program, which is the Young Adult Diversion Program. It is a really great program, no doubt, but I did want to just be really transparent about where it was and where it is now and where it is likely to go. So it is legislated that it's up to age 21, and we spent a lot of time with a lot of pressure from the Public Defender's Office to be able to do this program and have them serve their custody time in juvenile hall as opposed to the jail. That was one of the big parts of that. When COVID hit, we discontinued that because obviously we weren't having anybody in custody that wasn't absolutely necessary. But at this point, now that we're operating the secure track, we're not going to be able to open up that custodial aspect of the program. So I just wanted to be transparent about that because there's no ability to be out of sight and sound at this point. We were using the secure track area for that.
Thank you. I appreciate that. And not for this item, it's not on the agenda, but I would be very interested in an update, Chief, on the secure track process and how that's going, who we're housing, the movement of kids. But I realize that's not on today's agenda, so we'll figure out another avenue for that. Thank you. Matt, where'd you go? Matt, and then Molly O'Neill, and then back to Brandon.
Yes, thank you Supervisor Elmer. Just very quickly on the Jack list, administrative looking produces that and distributes it each day. Comes out in the morning. Today's list had 89 people. 9 of those people had been on that list for more than 30 days.
Oh, wow.
The vast majority are in there for about 3 weeks. That's what we're seeing. So this actually represents a significant improvement. It's everybody pitching in. It's a combination of from Brandon to Carly to Chief Garnett and a lot of people in between. It used to be a lot longer of wait time, and we can still do better. But I just wanted to point out that 3 weeks is a pretty healthy time frame, generally speaking. Individuals have individual needs, but it takes a little while to be stabilized in jail and to be ready for treatment. So I just wanted to point that out.
Thanks so much. Public Defender, Molly.
Thank you, Chair Ellenberg, and thank you, Mr. Cabrera, for the presentation. Those programs are excellent, and it's good to see them highlighted. We have worked really collaboratively to put them together and come up with innovative ways to get people better services, to have better outcomes. But one thing I just want to mention is if the programs themselves are great, but they're really not scaled up in a way that we'd like to see them. And so the numbers are important. And to your point earlier, Supervisor Ellenberg, it would be good to see kind of what the YA-DEJ numbers look like initially, where they are now. And same with prosecutor-initiated recalls, for example. We had a little bit of a slow start there, but we are working to pick those numbers up. So I think it would be helpful as we're looking kind of ultimately at alternatives to incarceration to try and scale up those great programs, which requires looking at the numbers. So thank you again, Mr. Cabrera, and we are very excited about all of them. One last thing, the ARC program is happening in Judge Erica Yu's department and was really developed through a lawyer in my office, Ben Stewart, who was recently honored as Attorney of the Year at Judges Night 2 weeks ago. And we hope that can be scaled up. But it again, is very nice to see all these programs highlighted. So thank you.
Thanks so much. While I'm thinking of it, Casey, I think it would be helpful to add the Jack list numbers to the quarterly population reports. It does help us fill out the picture, if that's all right.
Absolutely, I'll add that.
Thank you so much. Sylvia.
Yeah, so following up just on Molly's point, the scaling up efforts, I think is an excellent point. But I think, if we as partners in the justice system could help, for example, in the 1170.03 recall, and Brandon, you want to have at least a conversation or a partnership about how you're taking those cases, what criteria you're looking at, what if you share that with us, then we can support the scaling up efforts by identifying candidates for you, so that the ramp up is more significant. I know there's a lot of work going on in your office, and there's a lot of, but if we share the responsibility in identifying those clients, I think the scaling up would be a lot faster. So just an idea.
Thank you. Brandon, do you want to weigh in or respond to that? Or
real quickly, I'm absolutely willing to do that. All these are very early. I've only been on the job for less than 6 months, so I'm all for meeting with all the necessary court partners. I see a lot of friendly faces I already see here that I'm already working with. I'm an open door. I want these programs to be successful. I want them to work. Our goal is to get them up and running and even more people in these programs. The problem we're running into right now, and I think I see a lot of names in here that will agree, is staffing of the courts. The calendars are really, really overwhelmed already in our collaborative courts. We have sometimes over 200 cases a day on calendar. And so that's why the age of YA-DEJ is 21 right now, as well as ARC, and that one's been extremely successful as well. My goal is to expand them. I think we just need to really facilitate and give a lot more support behind the collaborative courts so that we can expand them.
Thank you.
But I'm absolutely here to listen and take any information from anybody and make these work.
I think this is really, really valuable work, and I am so appreciative of all of the partners across our departments. Are there any other comments from panelists before I look to the public? Supervisor Wasserman.
Thank you, Madam Chair. I appreciate that. I always have fun saying it's a sad day when I don't learn a new acronym. And Brandon, you were very helpful in adding to my acronym list. Thank you very, very much. Madam Chair, you made a recommendation as far as changing the reporting out of the meetings. I agree with that. I know this was a receive only, but if that was a motion, I second it. Thank you.
Yeah, let's formalize it quarterly and with the addition of more context and the JAC numbers. Do we have any public speakers on this item, Casey? Not Casey, sorry, Cassie.
There are no requests to speak, Madam Chair. All good.
Great, then let's take a vote on the motion.
Vice Chairperson Wasserman,
Yes.
and Chairperson Ellenberg.
Yes.
Thank you.
Thank you. Item 6 is the District Attorney Office's Public Law Enforcement Integrity Team update. And who do we have presenting that? Looking at my screen. Do we have someone from the District Attorney's Office in addition to Brandon?
No, motion to approve.
You know,
Hi, Supervisor Ellenberg. I know that Brian Welch oversees this, Assistant District Attorney Welch oversees that team, and Matt Raker is the supervisor of it. I don't see either one of them on the meeting, however.
Okay. I did have a couple of questions, so I'm going to hold that item for a moment and see if Stacy, if you don't mind, if somebody is available that might be able to answer questions, that would be terrific. And in the meantime, we'll go on to item 7, which is the Custody Health Services Quarterly Report. There's Dr. Day.
Okay, very good. And good morning, Chair Ellenberg and Vice Chair Wasserman. This is Eureka Day, Director of Custody Services, and I'm here today to report our quarterly report to you regarding grievances and other program updates. And if we can pull up the slide deck.
I'm just doing that 1 minute, Dr. Day.
Thank you. Apologies for the delay.
We can see the slides.
Okay, very good. If you can go to the next slide, please. Okay, and so our presentation for you today includes update data, not only on our custody health service grievances, but as you had requested, Supervisor Ellenberg, we're also going to be presenting on updates of other CHES programs, and so we'll be doing that in this presentation as well. Next. Okay. And before I begin our grievances, I do want to assure you, Supervisor Ellenberg, that for 2023, we will begin co-presenting and collaborating as you had requested to present our quarterly grievance update with our custody bureau staff and our sheriff's office. And so that will begin on our next presentation to you. However, today's presentation is about our current data that we have prepared for this committee.
Perfect.
Okay, next slide, please. And as a recap, the overall grievance program, as we've talked about before, is managed by the sheriff's office. The grievances, which are technically complaints that the patients in the carceral setting submit, are generally submitted now through primarily through the electronic existing tablets that each patient has access to, but they also have the choice to continue to submit those paper form. There are separate white cards. These are separate from the white cards that the patients also submit for requests for services through medical services. All submitted grievances are filed and tracked, and these are filed and tracked through the ADA Compliance and Grievance Tracking System, what we call ACES. And upon receipt of these grievances, our sheriff colleagues, they sort them according to category. They assign them to different business units, like housing, for instance, classification, and in our case, for medical purposes. And further, they will forward those to the respective unit in order to assess, analyze, and bring those to solution. Next slide. And so the following data presented to you this morning will show a comparative as you requested between 2021 and 2022. And as mentioned during previous reports, we have noticed that there have been some higher grievance volumes between 2022 and 2021. We've had some basic assumptions about why that is. And primarily, we're still analyzing some of those trends. However, part of that is that the patients have had access to their tablets, which made for an ease of access, as well as an ease of being able to file grievances in real time. The following slide, as you can see, is again information for data totaling custody health services grievances filed for the month of January through September for 2021 as a comparative to the data that has been gathered for 2022. And the data does clearly depict that there has been some influence where perhaps the electronic tablet has made that ease of access, and then that additional ability for the patients to grieve in real time. But regardless of that, custody health services, we do take every grievance seriously. We do investigate them thoroughly and bring them to resolution. And so even with the increase in volume, each one of those are attended to thoroughly and separately. Next slide. So this slide demonstrates a comparison of custody health services grievances and compared to overall grievances that have been filed through the ACE system. For 2021, as you can see, we had about 6,654 grievances filed overall, and of those 1,219 were custody health services for about an 18.3%. And there was some variability for percentages of those grievances. For instance, in August of 2021, it was about a 14.2%. And then there was a peak in February with about a 24.4%. And that was for the year 2021. And for the first part of 2022 to date, a total of 1,035 healthcare grievances were filed from a total of 3,963. And so again, with the number year to date, that's about a 26.1% for custody health services, representing an overall grievance low rate of 20.5% in January to a 35% in March. And again, these peaks and these variabilities that we're looking at, there is an assumption that it may have been the access to the tablets that the patients are using, but we're continuing to try to understand these trends and make some basic assumptions around the variability. But there is a noticeable, like I mentioned, a larger percentage of healthcare grievances in 2022. So we'll continue to look at that. We also had started during this window an incentive program for vaccination. We had a vaccination hesitancy program. And so that was where we were getting several grievances for the incentives, which really, I think the patients were, reaching out, trying to get the incentives. We had started the incentives originally for patients who were being vaccinated in-house. And so we did end up, and so we were getting a lot of grievances for patients who had been vaccinated already coming in, and they were filing those grievances. And so we have since realigned what that incentive program looks like. And so we have opened that up to all patients, regardless of whether they were vaccinated outside coming in and or whether they were vaccinated just inside the setting. And so overall, the most common healthcare grievance regarded was medical services, and we do have a larger number of those at the Elmwood site, but of course, Elmwood's bed capacity is almost 2.5% of what we have at main jail. So just because of the volume of patients there, we will typically just by equation, have more grievances filed at that setting. Next slide. And so as mentioned previously, custody health services, we do have a quality improvement program, a very, very, looking at the health of the organization, looking at trends, looking at patient safety, quality of care. And so each one of these grievances, they do a thorough look at, they analyze the data. We do the tracking through the ACEs. Our quality team also captures those data for trends that we need to make realignments with. We look at process improvements and opportunities for improvement. And so additionally, our quality team, they do keep track of the healthcare grievances. We do have a 30-day window in order to receive the data, not only analyze the data, have resolution to the data and submit that data so that that information can get back to the patient. And so that 30-day window starts ticking as soon as we get that grievance. And so we look at timeliness, and we're tracking timeliness over the course of that 30-day window. And this allows a QI team to also narrow down and look at any trends in data. We have basic assumptions. If we're outside of that 30-day window, a lot of it may be a resource compaction. So we do send additional resources to answer grievances if that's the case. Next slide. And so here you're looking at, again, a review of timeliness. And so the above graphs, as you can see, depicts a comparison for custody health services, handling the grievances by category, medical, mental health, and dental, and by facility, Elmwood and Main Jail, from January to September of 2021, and then of 2022. And the top orange bar is for the 2022, and the bottom, of course, is for 2021. And as you can see, we still have some variability in those numbers. Overall, our custody health services grievances demonstrate how the electronic tablet, again, another assumption, may have had that variability and increase. But even more to that, that twofold increase for 2022, the grievances, we are, again, trying to improve our timeliness, making sure that the grievances are answered within that 30-day window. And a large part of that, again, speaks to the volume of those grievances that we're getting between Main Jail and Elmwood. Next slide. And so before I go on to the program updates, I will open for questions if you have any. Otherwise, we can move on to the program updates.
Just a quick comment on the data. Thank you so much for adding the comparison the comparison of years, Dr. Day. I appreciate that, and certainly it makes sense with the tablets now and a higher jail population that the volume of grievances would be higher. We discussed previously the impact of that subset of people who are filing multiple grievances.
Correct.
I think it would be helpful, in our pattern of continuous iteration, is if the next quality report could include not just the monthly volume, but the number of unique individuals filing a grievance during the month.
Absolutely. And we do track that, supervisor, and we're calling those discrete, meaning that these are discrete individuals with multiple grievances. And even with that, though, we answer each one of those, but it is driving, it is driving the numbers to look a little skewed if you take it down by those folks that are submitting multiple grievances at a time.
Yeah, I think that's important too. It gives us a clearer idea of what the culture and the environment is as well.
Absolutely.
Thank you.
Okay, and we'll go into the program updates. Next slide. And so a couple of things. And first, I do want to, thank the board and thank you all for a lot of the different programs and initiatives that we were able to get through for the budget cycle 2021-2022. Or 2022-2023 as well. But we do have a behavioral change model that we had submitted that we are looking at a RFSQ, which is a request for special qualifications. And this is a model that we are rolling out across the organization where it is, specifically to address the patients and their ability to have self-agency, look at behavioral approaches. It'll be a systematic approach using motivational interviewing, DBT, and other modalities in the mental health program, primarily to work with those patients who have either dysregulated or maladaptive behaviors. And so that is in process as we speak. And we also are looking at our peer support program. And as you know, we had submitted for peer support staff. And part of that was to take a step back and look at the ability to get some of these staff in the door. And I had mentioned before that we are looking at just that safety and security and the security clearance and background checks and working with other counties to see how they have obviously gotten staff in the door who have lived experience. And so also working with our custody bureau colleagues here, and our custody bureau colleagues here are very supportive of getting any of our applicants, once we fly these positions, in the door. However, they will be looking at with us as we get these applications, a case by case review of the case factors with anyone who has a lived experience coming into the jails. And a lot of that is looking at what we call the adjudicative guidelines. And so that may mean what, their crime, if it was a high level, low level crime, misdemeanor versus felony, the time in between their crime and their application. If it was something they were 20 years old, now they're 40, they haven't had any more involvement. But each one of those will be on a case by case. There's sufficient case factors that we will look at. But our custody bureau, as we get these applications, we'll look at each one separately and pretty much try to get that clearance in the door. And so we're excited about that. But we do have, and this is across the other jails too, mentioning that there's other jails doing this, but each jail has their own parameters. And so, but pretty much they do a case by case, look at case factors. And so if you have any questions on that, but we are excited to pursue the peer support program and get those folks in the door with lived experience.
Dr. Day, I do have just a quick question. I really appreciate hearing that you're comparing, that you're reaching out to other county jails to see what they're doing. Are the background and security check requirements at the discretion of each sheriff, or are there external barriers or things that are beyond our control to account for?
Yes, in order to come into the carceral setting, it is a requirement. And so the background and security background checks are required. And
requirement, or is it a requirement that each county sheriff can design on their own?
No, it's a requirement. And that is just at the baseline, it's a requirement for having the background
So
check.
sorry, I don't know. I may not be asking it clearly. Is it a state requirement that is uniform across all county jails?
From my understanding, it is. However, I do have my colleague, Assistant Sheriff Sepulveda, on if you wanted to take that as well.
Yeah.
Good morning. I'd be happy to assist.
Yes, thanks. Yeah.
Hi, this is Assistant Sheriff David Sepulveda. Good morning, Chair Ellenberg and Vice Chair Wasserman and the rest of the team. It's kind of twofold. So there are DOJ requirements with regard to our CLETS policies, procedures, and practices. It's a state requirement with regard to folks coming into the jail system that may or may not have access to seeing CLETS data. That's one of the big elements that why we require the background checks for folks coming in. And it's a standard practice amongst the jails and prisons in the state for security reasons as well. So it's kind of a twofold piece. And so what we do is we analyze each in the purpose of the entry into the facility and weigh that out, with the need factors versus what's in this person's history and background. And if there's a concern, like in this case, we understand the need for peer support and how effective it is. And so if there's a situation where a person is questionable or maybe not passing the normal required checks, then that would escalate to my office and I would review it individually and weigh out the need to make exceptions. And then when we do make those exceptions, it's not just a blanket exception. We just put other parameters in place, like, the need for an escort, or if they have to be in certain areas, we take certain precautions. So it's not just, we're blanketing it, but we make precautions so that we're ensuring that we're following the state regulations.
Thank you so much, and Sheriff Sepulveda. That's helpful. And I wasn't trying to suggest that we shouldn't have any. I just wanted to understand
Sure.
that we had local.
No, I understood that, ma'am. Thank you.
Okay, Dr. Day, thank you.
Okay, very good. And next slide, please. And so this has been an initiative for some time, and we are happy to say that it's up and going. We've had a soft launch in late June. We do have all 6 of our medical unit clerks on board for the discharge program. And as mentioned before, we have each shift, morning, evening, and night shift, has an assigned medical unit clerk that is working in tandem and co-located as close as we can locate and working in tandem on releases. And so we had a soft launch, like I mentioned. The soft launch was in late June. And so we're looking at all of the logistics, lessons learned, things that we continue to need to realign. And so that is in place now. And part of what these clerks are doing is that at release, they are getting what we call our after ABS after visit summary. Patients are leaving with all the information that they need in order to access medications. They get information on reentry center. They get information on shelters. We're also now trying to put actually information on how they could actually access their medical records. And so that's something we're doing as well. And so they get all of the information. Those patients that are in our MAP program leave with Narcan kits. And so that's in place. We'll continue to look at the volume utilization and what we need to do to streamline that program as we go on. Next slide. Part of that too is, like I mentioned, and I think I probably overtalked my slide, but when our clerks are working with our custody release officers, we are actually, looking at volume, looking at Monday through Friday. We do know that we need to look at our weekends and holidays and make sure that, by volume of releases that we're trying to cover the weekends and holidays as well. We are offering so far, June to date, 700 release packets, and we are offering bus tokens as well. And so we've offered 183 bus tokens, and we're actually now building those bus tokens in and these kind of transport vouchers, if you will, into our current budget process so that we have those on board. Next slide. Our medication-assisted therapy, I'm very excited about this program as we continue to grow it. And as you recall, with our MAP program, as part of the Custody Health Services efforts in combating and treating our substance use disorders and opiate disorders in this setting, we are working very closely with other justice-involved systems as well as behavioral health. The program consists of a multidisciplinary team headed by our medical director that utilizes medications as we continue to treat patients with substance use, substance disorders. The MAP program also works with our Valley Homeless and Healthcare Programs, a mobile health center located with the Office of the Reentry, as well as with our behavioral health colleagues that we partnered with very closely in these efforts around MAT and other system programs and entities in the community, to include the probation, public health, and the sheriff's office. And so in 2022, we had a number of continued figures that we're looking at and looking at the data of the patients that are going through the MAP program with the opiate use of fentanyl and other addictions and disorders that are not only plaguing the community, but also that we see on a micro level here in the jails. And our custody health services, part of the vital services that we're offering, we are funding that now in our budget. And I don't know if we talked about before, the MAP program as it started in custody health was a grant program. And as that grant very limited, and so we have actually started to fund that program in our budget to include the medications that are specific for the MAP program and getting coded positions and to work with that program to provide the additional services that are necessary. Okay. Next slide. And so for the successes of the MAP program, we've had many successes that we have published in peer-reviewed journals, part of the work that we're doing in-house, and we're very excited about that. These are IRB peer-reviewed. We also have mentioned to the board in the past the funding to support the behavioral health and sanitary opiate overdose and prevention projects. We have secured Narcan vending machines. We're pretty excited about that. We have received those. We had those set up already at Elmwood Jail. We had delivered here just recently at Main Jail. It's set up in the lobby. And so we're pretty excited about that. And not only are we running video loops with those vending machines, we're also providing education. So that's available too. And it's free to the public. So therefore, we're going to be looking at utilization. There is a capacity with these vending machines that we're utilizing that we will be purchasing that capacity of telemetry. And there's a telemetry capability with these machines where we'll actually gauge and measure and monitor utilization. And so we can gauge the utilization of the machines. We also can get to par levels, so knowing when we need to restock those machines. We're looking at adding fentanyl strips, and so that's a part of this, as well as condoms. And so we've had a conversation with that. I do want to again give hats off and to the collaboration that we have with behavioral health. We have meetings, joint meetings, and we're really working to, impact the fentanyl, Narcan, mortalities in the community by making these accessible to the community and at no charge. Next slide. So that is my presentation, and I will take any questions if you have them.
Thank you so much, Dr. Day. I have just one further question. Thank you for accommodating my asking them throughout the report.
No worries.
On the study that was published on the MAT program, and the consideration that jail releases in the morning may reduce emergency department visits, what would it take to be able to implement the change in release times, and what kind of coordination with the court would be necessary to do that?
Sure. And we've had these conversations. As a matter of fact, I think the court is in support of it, and the court has made some exceptions already, especially in releasing women at different hours of the day. But part of that is the patients. As far as when the release happens, our custody colleagues have up until, I believe, midnight to get folks out. So that churn is happening all the time. And so in working with our judges right now, and it would take basically the judges, saying that by this time tomorrow, for instance, by 9 a.m. tomorrow, you are released. But I'm going to refer to my legal our criminal justice folks on that, but we are talking about those conversations. And we do, Supervisor Ellenberg, if there's a particular case where there's a concern to release someone over in the after hours, we have worked with the courts, and the courts have given us permissions to release that particular person the next day. A lot of this, as you know, with the resources, especially with just that continuity and care and resources, and many of these are closed and not accessible after hours. And so I think it's a critical area that we need to take a look at and realign what that release looks like.
Thank you so much. In the next quarterly report, I would appreciate the continuation of including program updates, including the status of the behavioral change model implementation, and in the next report, any work that's underway between custody health in partnership with public health on STD prevention and the continuity of care for HIV and syphilis prevention.
Very good.
Thank you so much. I'm going to look to the panelists and to Supervisor Wasserman for any additional comments or questions.
Thank you. I just want to, through the chair, to compliment Dr. Day. This was a whole lot of slides that you sent us well in advance, so I appreciate having the time to be able to look them over and the additional detail that you added. And we do have one member of the public, Madam Chair.
Thank you very much. Excellent clerking as well as supervising.
Thank you.
Let's give the public speaker 2 minutes, please.
Okay. Our next speaker is Paul Soto. You would have 2 minutes to speak. I am unmuting you. The timer will begin when you begin speaking.
Thank you. Good morning, commissioners. My name is Paul Soto. I'm from the Horseshoe. I have 35 years of experience in this jail, and I can tell you that there's a very distinct, clear dichotomy between what it is that you were saying in this report, which is just a bunch of words, and what the actual lived experience is. They couldn't be more stark in their differences. And so we really need to get someone like me, and I'll volunteer to be on these panels. One of the things that I think that the reasons why there's so much resistance to someone like me is because I'm going to tell the truth. And the truth is going to contradict what it is said in these meetings. Because where I'm coming from, none of you have done time. I've done time recently. I've been recently released from this jail. And I've spent over 35 years in this county system. So, until we get to a point where we can legitimize the lived experience, the actual experience in these policies, I kept some of my grievances. The grievance process is a joke. It's literally a joke, because to wait 30 days to receive an answer for a medical condition, that needs to be reduced to 7 days, And so that's number one. Number two is that the mental health system, you're using the jail in order to accommodate people that really belong in mental health facilities. The jail is the largest mental health facility in the country, our jails. So we really need to start talking about that issue. Number three is it's illegal to keep a citizen incarcerated past 12 midnight. Well, if you keep them incarcerated past their release date, that is a crime. You are keeping that is false imprisonment. So you can't keep the person past 12 o'clock. So that's that issue that needs to be addressed. It's illegal to do that.
And that concludes our speakers.
Thank you very much, Camille. I don't think we need a motion on this item. So I'm going to move back to item 6. Looks like we've got folks from the district attorney's office here on the public enforcement integrity team.
We do, Supervisor Ellenberg. He's under my name, but it is Jason Malinsky who is on the team, and he is here and ready to answer any questions you have. Sorry for the delay.
No worries. And thank you so much for joining us. I'm sure you have a very busy morning. I really do appreciate the DA's leadership in his been the ARC reforms and admire the public law enforcement integrity team's contribution to public accountability of our law enforcement officers and elected officials. So thank you for the report. The ledge file notes that the team fields complaints from members of the public, but when I went to the DIO's website, I didn't see where a resident could submit a complaint. Can you either share where that is or create a mechanism that will make it more transparent and accessible?
Sure. So I can share with you, Supervisor Ellenberg, that we often receive them through the DA's email, the general email to our office. Either there have been instances where they go directly to DA Rosen or to the general DA's office email, and those are forwarded to our team to respond to the member of the public and investigate the complaint.
And so you don't have or don't feel the need to have a specific email address or access point for these?
To be perfectly honest with you, Supervisor, I don't know where that email is located. I deal with them when they come in, but I certainly could look into that issue. And if it's not totally clear for the public, I can, we can discuss internally how we might be able to make that better, because we certainly do want to do what we can to serve the public the best that we can.
That would be great, Jason. And if you could share what you find with us off agenda, that would be very helpful, because then we can also share with constituents that reach out to the Board of Supervisors offices what the most direct way is to submit a complaint or concern or question.
Sure.
Thank you so much. The assault by the probation juvenile counselor in June, of course, was really deeply disturbing. And I'm wondering if, in addition to providing information to support criminal investigations of individual officers, whether there's any oversight of departments that are obligated to or should be taking some kind of remedial action to ensure that the incident doesn't recur. Is there a role for the district attorney's office in that oversight piece as well?
Interesting question. I actually tried the case, the case of Robert Medellin, the probation officer that was convicted in June. As far as departmental oversight, you know, I think I'd defer to Brian Welsh, who's out of the state right now on a family matter, and he may know more. I certainly know that and am aware of oversight of the sheriff's office that is ongoing. But as far as other departments are concerned, I'm not aware of the full scope of other consent decrees that may be in effect or other agreements that may be out there and controlling those sorts of issues.
Thanks. Maybe since this was probation, I'll turn to Chief Garnett and would be interested to hear about any actions, if any, that have been taken in the aftermath of that assault to prevent the same circumstance from reoccurring.
Yeah, thank you for that question, Madam Chair. So lots happened since then. And I think you remember from the confidential memos, we had recently installed cameras in the last few years. And that in itself has just made a phenomenal difference because we have cameras anywhere where children are. And we didn't have that before. So that in itself made a huge difference. I will say we're certainly not under any kind of consent decree or anything like that. We spend an inordinate amount of time training our staff on de-escalation techniques. And I think we have a pretty strong reporting mechanism. I think our staff are really, really clear that if you see something, you say something. And if you don't, then you will probably be terminated. And we're pretty hardcore about that because 99.9% of our staff are phenomenal and do a great job. And they don't want people that are doing bad things to kids in our department either. So I feel like the sheriff's office did exactly what they should have done. The DA's office did exactly what they should have done. And the end result was what it was. But I certainly don't see that as being a ongoing issue or an epidemic. And we certainly have a very, very active public defender's office. So if there were issues, I'm sure you would be hearing about them because they talk to the kids every day.
I'm certain too. Thank you so much for that. Sylvia.
Yes, Laura is correct. We are very much on top of stuff, but we also have a very collaborative relationship with Laura, her department, Molly and her staff and mine. But I think one of the, and I can also attest and confirm that the culture in the probation department, especially the juvenile division, has changed dramatically over 20 years. And these incidents occurred 20 years ago, and the culture is different now. So I think there is that component of mutual accountability, that the culture itself holds people accountable, which is probably the most valuable thing than having an oversight board, which is again valuable and it should happen. But I guess my point was, and I wanted to ask Laura, to the extent that you could share, was this sort of an aberration that was just an individual and not indicative of anything else or any other broader systemic issues?
Yeah, it was just an individual. It was absolutely shocking beyond belief. And I mean, I think it does speak to how shocking it is. I mean, it occurred at, I don't know, 2 o'clock the day before, 3 o'clock the day before. And Nick Burchard and I were reviewing the video before 11 o'clock the next day. So it had already been reviewed, sent to supervisors, sent to managers, and we were reviewing it. And the sheriff's responded immediately. And then the DA's office took over. So yeah, I very much think it's so out of bounds that, there was no issues about people reporting it. I don't think there were issues with people testifying in court. Yeah, it very much is out of the ordinary and was treated very much out of the ordinary.
Mm-hmm. Thank you. I appreciate all of this information. I'm going to go to Molly and then to Judge McGowan.
Thank you, Supervisor Ellenberg. Can you hear me okay? I've had problems with my microwave. I just want to tack on to what Sylvia said. Our office represented the minor who was the victim in that particular case. And I received a call directly from Chief Garnett, I think immediately after she and Nick reviewed the video. The next morning at 8 o'clock, I was there with the lawyer who represented the kid watching the video. They were extremely alarmed and communicated that. And I would say it was quite an aberration, and they were shocked and we were shocked, and it was dealt with really appropriately. So thank you.
Thank you. Judge McGowan. You're muted.
Thank you. I don't wish to speak to this issue. Madam Chairman, let me apologize. I took a call from the grand jury during Mr. Cabrera's report, and I believe I missed the opportunity to report out on behalf of the court. Would you please come back to me at your convenience before we convene today?
Absolutely. We'll do it right after we conclude this item.
Thank you.
Thank you very much. Are there any other comments from panelists? Do we have any public speakers?
We do have one member of the public who'd like to speak, Madam Chair.
2 minutes again, please.
Okay, thank you. The next speaker is Paul Soto. You will have 2 minutes to speak. I am unmuting you. The timer will begin when you begin speaking.
Yes, Paul Soto from the Horseshoe. The first time I went to juvenile hall was 1980. I was arrested by a program that's called TABS. What they used to do is go around the streets, and you were on the streets between 8 and 2, you were arrested and you were taken to juvenile hall. And that was my first introduction into juvenile hall. And it doesn't surprise me that this level of violence occurred there. It doesn't surprise me at all, because I was a witness to all of it. But I was also there at a time when it was okay to abuse your children publicly. You could do it in a grocery store. You can literally beat your kid in a grocery store, and it was okay. So just imagine that was okay on the street, what they were doing to us inside of juvenile hall. But of course, nobody wants to, research that. They just want to, oh, it's the past. It happened. But that still lives inside me today. And when I heard about what this man did, I was like, yeah, because there was a lot of unreported cases that had happened in juvenile hall. This is not the only incident that happened there. There was a lot. You want to talk about underreporting of violence of staff against inmates, be they in juvenile hall or the county jail. For every one that's committed, there's probably 20 or 30 that go unreported. And the severity is probably exceeds that which is reported. And so once again, until we get to a point to where we can understand what kind of people are attracted to working in jails, which there's an element of sadism that exists within our jails that nobody wants to talk about, nobody wants to acknowledge. You just don't acknowledge, you don't look at it, you don't have to accept it, okay? We need to get past that. We need to accept sadism exists in our county and juvenile systems. People that are sadists apply for jobs to get into these systems because they enjoy the suffering of other human beings. So we need to get to a point where we can discuss that openly, honestly, confront it, and then maybe we'll see some changes. But we're going to see more of this. It's more the same to me.
And that concludes our speakers.
Thank you very much. I think that concludes item 6. And we have taken care of item 7. Before we move on to item 8, I'm going to turn back to Judge McGowan, who is going to talk about item, take it back here, item 5.
I apologize to all of you. The grand jury had an indictment, and Mr. Cabrera, thank you for that presentation. I just wanted to update all of you on a few things. First of all, the court does still maintain 2 closed courthouses, the Santa Clara courthouse that handled traffic and the old courthouse, which handles civil, remain closed. They are closed due to the shortage of sheriff's deputies available to the court. They closed in June. We are working directly with the sheriff's department. We have obtained some extra help, security guards to help staff metal detectors so that deputies may be deployed to courtrooms to keep the courtrooms running. That is in an effort to continue to work on the inventory of cases that remain. Those courthouses will remain closed so long as the shortage continues. We are looking at relocating some of the traffic services to both our Family Justice Courthouse and our Morgan Hill Courthouse so that traffic is more accessible to the public. I'm very pleased to announce that we are extending our clerk's office hours. We have had significant complaints from lawyers and self-represented litigants, and we have increased our staffing. So effective December 19th, every courthouse clerk's offices will be open from 8:30 until 3 p.m. and on Friday until 1:30 p.m. That's a significant change of where we've been during the pandemic. Mr. Cabrera, I'm happy to inform you, if you did not know already, that YADEJ and other programs will be expanded next year in 2023. In Department 62, that courtroom will be open at least one additional session of every week in an effort to expand the ARC, CAMP, and YEDEJ programs. With respect to the mental health treatment courts, Judge Manley and Judge Silva will be expanding their court sessions as well. There will be 3 additional weekly sessions. So hopefully those calendars will go from 200 cases a day to closer to 100 cases a day. Right now, those calendars are being set up and the expansion will occur in mid-January. We trust and hope that our justice stakeholders will be able to staff those additional calendars, but the programs are all growing in those areas, and even though they are not mandated, and even though they do not fall within our inventory of COVID backlogged cases, we appreciate and understand the investment in those programs. We support those programs. So even though those courtrooms are not mandated courtrooms, they will remain in an expanding mode. We are also looking at moving the AOT program with the aid of behavioral health over to our probate departments because they are not criminal in nature. And we anticipate that that will be a predecessor of care court when care court comes to our county at the end of 2024. Judge Manley will undertake some training of our judges in the probate division, but because they are already doing a number of LPS calendars and county calendars with the county conservator, we believe that probate is the best place for those non-criminal, no violation type of cases to occur. So those are the plans of the court. That's just a high level summary. These changes will occur in the middle of January, and I'm welcome to answer any questions. I should say that the court does not contribute to Casey's ledge file. So if there's anything you have to ask, please feel free to do so. I'm happy to give it a try.
Thank you so much, Judge McGowan. I really appreciate the details and the transparency of your report. With the extra help deputies or deputy equivalents, will that be sufficient to open the other courtrooms, or is there any other support that would be helpful from either any of the county departments in opening more or doing whatever else you may need to reduce the backlog?
We have 2 significant problems right now. We won't call them deputy equivalents because we love our deputies and they do an excellent job for us. But we are very grateful for the security help that we're getting at the metal detectors. We have some significant growing pains. There is a very different role for a deputy to provide services in a neutral courtroom as opposed to the conduct of a deputy trained to conduct a traffic stop out on patrol. So we are going through an education process right now. Deputies will not relinquish their role in the courtroom. They're only granting the assistance for the metal detectors for now. Our other primary shortage is with respect to court reporters. That is a national shortage, just like deputies are a national shortage. We are reconfiguring our calendars for next year to pull out every misdemeanor case that we can from every calendar. They will all proceed on an electronic recording so that our court reporters can cover mandated proceedings which fall primarily into the juvenile and felony areas. And I wish there was a way for you to help, but unless we can clone some court reporters, I think that one will continue to be a challenge for us as well. Thank you.
We are good, but I don't know that we're that good. But it is interesting. We've got workforce shortages in so many county departments as well, and particularly in the childcare sector and mental health clinicians and treaters. So yeah, I hear that shortage, and I'm glad to hear about the workaround with the electronic recordings for where that's appropriate. Do any panelists have any questions or comments for Judge McGowan?
The court currently has 56 funded positions that we have not been able to fill. We have just promoted 14 courtroom clerks to help assist in getting these cases heard. Unfortunately, they're promoted from our clerk's office, so it makes it much harder to process the paperwork required. I think that's everything I know on the subject. So if there's not anything else, I'm going to excuse myself and run down to the grand jury. Thank you.
Thank you very much, Judge McGowan. Take care. We already did public comment earlier on this item, so I'm going to move right to item 8, which is the Adult Custody Office of Mediation and Ombuds Service Annual Report.
Yes, good morning, Chairperson Ellenberg and Supervisor Wasserman. Alan Kula here. Francisco Hernandez is also here. Francisco is our ACU. He is the person who the concerns and needs with the inmates who call our office on the phone. He also is the person who goes into the jail to speak to inmates when there's a need, and will be doing more of that since he's now able to do more of that in 2022. You have our legislative file, and you also have our PowerPoint was submitted with the legislative file. Do you want us to go over the PowerPoint, or would you like to ask questions based on that? What would you like us to do at this point?
I am happy to go directly to questions. I know that we've all had the opportunity to review the report and the slides, and that is very, very much appreciated. Supervisor Wasserman, does that work for you?
Yes, ma'am, that does. Thank you.
All right, so let me look first to panelists. I have a brief comment, but want to see if there are any questions. First, not seeing any hands. I definitely just want to recognize this Office of Mediation and Ombuds for your work to really work towards innovating restorative and transformative offerings here in our county. And of the many reforms our departments have made, I particularly appreciate how OMOS's programs really hold true to the restorative and transformative justice approach of seeking to address, repair, and prevent harm through individual and community and systemic approaches. I wish you only continued an expansion of philosophy and responses. I'm going to ask my staff to forward your report and the slide deck to the Alternatives to Incarceration work groups for review, particularly the Criminal Legal Process Group, which identified restorative justice programming as one of their priorities. And I'll look forward to hearing their feedback on how we might see these efforts grow really across and be embedded in our overall justice system as we reevaluate our methods of traditional punitive justice and really seek to move towards safe alternatives to incarceration that do promote sustainable public safety and accountability and reduce recidivism. So very much appreciated.
Great. Thank you so much for your kind comments and for your recognition of our program. We really appreciate it.
Absolutely. Do we have any public speakers?
There are no requests to speak, Madam Chair.
Okay, then item 9, I believe we are deferring. There was a request to defer, which I was happy to accommodate, to the December PSJC agenda, which moves us to, let's see, item 10, we move to consent, the OCLEM work plan. Item 11 is for announcements from any of the PSJC department heads, and the court has left us, but department heads. Sylvia.
Yes, thank you. I just wanted to announce, and I believe some of you have already received the announcement, but we welcomed Lana Credier as IDEO's as a new assistant director earlier in October, and she's doing exceptionally well, and really looking forward to having her meet all of you and collaborate in the work that we're doing.
Thank you. Any other departments looking? I have just.
Yeah, I thought I thought I'd give you a quick update on the secure track, if that's.
Absolutely, please do.
And then we can do a more formal report, maybe at February or March. So we currently have, I've got to add. $17 youth in the secure track, 1 girl, 16 boys, ranging in age from 16 to 21. And we're expecting between 10 and 12 youth to be returned to us from DJJ before the deadline of June 30th. So we've been working really closely with the courts on getting those cases on calendar. There's multiple work groups doing all kinds of different things, but right now we're really focused on the programming for these youth, and then getting the youth from DJJ back with enough information about where they are in their treatment that we can, continue that. So lots going on.
Thank you for that, Chief Garnett. Others? Great. I will just share a brief update. As many of you know, I serve as the Vice Chair of the California State Association of Counties Administration of Justice Committee. And next week, CSAC will announce our 2023 legislative priorities, and want to share just very high level what we are proposing to the committee for adoption. First, CSAC plans to advocate and coordinate with the state to ensure that counties receive adequate resources and funding to assist the Department of State hospitals in reducing their current IST wait lists. Second of all, juvenile justice realignment continues to be a major priority for CSAC, and Chief Garnett has been a statewide leader in this work. This year, CSAC and our partners in probation were pleased to see $100 million in state one-time funds for juvenile facility modernization. And we hope to build off of these investments in local juvenile justice and advocate for additional funding for critical needs, including staffing, specialized treatment programming, and facilities that support trauma-informed care, restorative justice, and rehabilitation. Finally, we're planning to advocate on the federal level for funding through the state criminal alien assistance program, and that's a name that needs to be changed, the Edward Byrne Memorial Justice Assistance Grant Program, and the Second Chance Act, the Victims of Crime Act, and the Violence Against Women Act. These priorities are included in the agenda packet for the CSAC Administration of Justice Committee's meeting, which Camille will post today under this announcement items in the online agenda. The packet also includes the committee's updated platform and memos on juvenile justice realignment from CSAC and the newly formed California Probation Consortium. And I would ask, please, that if any of the departments have feedback on the AOJ work or proposed policies that's going to be presented to counties across the state next week, please reach out to my office before next Tuesday so that I can incorporate your comments. Thank you very much. If I don't see any other hands, Supervisor Wasserman.
Thank you. I wanted to say to all the panelists that are still here how much I recognize how valuable all of your time is, and how much I appreciate you investing so much time every time that we meet. I really, really do. Thank you.
Thank you very much. With that lovely send off, we'll adjourn this meeting to the next regular meeting on Thursday, December 8th, 2022 at 10 a.m. And Camille, great job clerking. Thanks, everybody. Bye.
Thank you.
Thank you. This meeting has been adjourned, and we shall now close this meeting. Thank you all.
Recording stopped.